Hello, friends and followers. I'm Velvet Spicer, and I'm the Communications Manager for the Rochester and Finger Lakes Region chapter of the Alzheimers Association. I'm here with Cynthia Adell, who is the CEO and founder of Rochester Health Engagement Partners, a not-for-profit organization that empowers the African American community to lead healthier lives by giving them the tools that they need. She has more than 25 years of experience in the areas of community building, education, and outreach, and working with underserved populations. And the Alzheimers Association is a worldwide voluntary health organization dedicated to Alzheimer's care, support, and research. Our mission is to lead the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. Our vision is a world without Alzheimer's and all other dementia. Now, the goal of this partnership is to bring information and stories to those who want to learn more about Alzheimer's and dementia from the perspective of people of color. And we realize that people receive information better from those who look like them and share some of the same experiences. Data shows that older African Americans are 2 times more likely than older whites to have Alzheimer's, and they are less likely than whites to receive a diagnosis of the condition. They're also less likely to seek support and resources to assist them. So we're hoping this partnership between nonprofits will help you find the answers that you need and encourage you to get involved in whatever way you can. I'd like to introduce our guest, Leslie Harvey. He is the program manager and handles diversity efforts at the Alzheimer's Association Rochester and Finger Lakes chapter. Welcome, Leslie. It's nice to have you.
Thank you so much. Glad to be here.
Great. So why don't we start with a brief background on you, Leslie. How did you make your way to the Alzheimer's Association?
Well, it all started with someone had approached me about having an event at our church, the African American Health Symposium, back this past April. And we started to work with some of the members from the organization, and it just kind of grew from there. And as I started to meet more people from the organization, I remember one day saying to one of the guys that, geez, you guys got me doing all this work, you might as well hire me. And lo and behold, an opportunity came about, and here I am.
Wonderful. Well, we are so happy to have you with us, Leslie. So, one of the things that we know is that racial inequity plays a really large role in the health and healthcare of people of color. What's your experience as an African American male in the healthcare realm? Have you or anyone you know experienced inequities personally?
Absolutely. I definitely, with the work that I've done here in the Rochester community for many, many years now, you certainly get the opportunity to talk to folks. And there's a lot of individuals that certainly don't even have access to health care, which is certainly one of those things that it just shouldn't be, right? Because health care is so very, very important. And, we started to talk about some of those inequities, and one of those could possibly lead to folks not even having or knowing that they need to get some assistance for certain things like Alzheimer's.
We know that African Americans accept information more readily from people that are African American. How have you been received within the community?
Well, I think the biggest advantage that I have, Cynthia, is the fact that, I'm not new to the Rochester community, right? I've been doing work in different capacities for a good number of years. I think back to certainly my time at Wegmans, doing some work in the community, Hillside Work Scholarship, doing some things with young people, the time that I spent with the Housing Council, talking about housing inequities for over 10 and a half years. And so now, it's just a little bit different twist. It's still one of those things that greatly affects the underserved populations here in the Rochester community. So I already have that established presence. It's just a little bit different message.
Well, that's great because you already have an established presence, a recognizable face. I recognized you this morning. And also, I think it's awesome that it is an African American male that is a part of the Alzheimer's team, because a lot of times you don't see that within organizations. You might see African American women, you see them all around town, but to have a representative that is an African American male. I think that's powerful because a lot of African American men would probably readily receive whatever message you're trying to convey because you share the same experiences of an African American male, not just an African American.
Yes, yes. So very true.
Great points. So, Leslie, how has Alzheimer's disease personally affected you or those around you? Because you were very heavily involved in our African American Health Symposium this year. So I'm assuming that you have a personal history with the disease.
Yes, that I certainly do. Being a member and an officer at a very large church here in the Rochester community, there are certainly some individuals that I was very close with that had dementia. And, you watch the struggles that these individuals, have gone through and how their families have certainly struggled. And one of the greatest things that does my heart glad is that we were definitely looking forward to establishing a support group at our church because of the fact that a good number of members are either experiencing that or have gone through Alzheimer's and dementia in their family. And, my church family is very, very important to me. So I'm looking forward to making some of those things happen. It was kind of funny that last week I actually had reached out to one of the ladies that I'm looking to really serve as a facilitator for the support group that we're going to start. And she sent me the nicest email back as we started to talk about some of the things that she'll need to do in terms of her training. It was just the sweetest thing that it's something that I'll cherish because that's just who this individual is. She's a sweetheart anyhow. But she is so excited about the possibility as we move forward to get the support group started because we know that there are folks within our church that are starting to experience such.
Thank you so much, Leslie. And that kind of leads us into our next question. Why don't you tell our audience about your role at the Alzheimer's Association, particularly as it relates to the diversity, equity, inclusion. But we do want to hear a little bit more about the support groups as well.
Absolutely. Yes. So my role at the Alzheimer's Association is as program manager. And with that comes definitely one of those things where I'm there to support or help to support certainly those groups that are there. And we have some wonderful facilitators with our various support groups. And it's just been amazing just to sit in on some of the sessions that they have on a weekly basis. It just really touches your heart to really see what families are facing, through this dreadful disease. And so I'm really excited to be a part, certainly just to be there to just kind of help guide them through a very difficult disease. The other thing that I'll be focusing on is certainly diversity efforts here at the Alzheimer's Association. One of the things one of the challenges that we face, certainly here locally, and I don't know all the numbers nationally or anything like that. I'm fairly new to the organization, but I definitely have a keen interest in growing our numbers here locally in terms of having diverse candidates work within the organization. So recruitment is going to be huge for us. Also retention, that's going to be a big piece of that. We don't want to just bring them in where they stay for a little bit. We want to be able to retain those individuals on a long-term basis. So I'm very excited about that piece of it.
Leslie, do you think that you have had to use regular methods in your short time there? I know you're still strategically planning how you're going to really connect with the community, but do you think that you'll have to use regular methods or be more creative to get the information out to the African American community?
Well, I guess from my perspective, I don't see it as anything new by any means, Cynthia. I think it's just a matter, having done this work before, over the last, I'd say 20, 25 years, my big thing is that I want to be able to always meet people where they are, because we know that with our underserved populations, there are always some barriers, right? There can be barriers to transportation, barriers to really technology and things along those lines. So I don't want to do anything that's going to create any additional barriers for our folks. So I'm very big on meeting people where they are. So if that means I we do an event at another community-based organization where they're working with seniors, it could mean, going to a park, right? Where there's an event, and we, put ourselves there. So whatever it takes to make these things happen and get the information out to our people, I don't mind doing it. One of the things that we were talking about in a meeting this week with one of our other staff members is, as we start to plan some activities at some of our churches, whether it be Purple Sundays, or it might be just an information session, right? We're going to put ourselves at those churches on a Sunday morning. I certainly have an established presence also in the faith community. I've been around, like I said, Black pastors and some of the Hispanic pastors that I know. And we're going to touch bases with those folks, and it's going to make some great things happen, because our people need to know this information. They need to know that there's help and there's support out here. So whatever it takes. Yes.
Definitely. So you answered somewhat my other question as far as what are some of the ways that you'll reach at the African American community. So I'm assuming that you'll be at health affairs, you'll be at block parties, your social media presence, your I know you have a YouTube channel, different sources like that, and utilizing modern technology to reach people that do have broadband services. So yeah, just making those connections, they're key. So I'm looking forward to seeing you out there more often as
That's
well.
not a problem.
Mm-hmm.
We're
so
excited.
What are some of the challenges that you have faced so far in your position, your little short time there, and within the community? Some of the challenges that you've faced.
Well, I would say one of the challenges that, certainly right now, most of my time is spent, with various trainings that we have to go through. Once we get through that, we can really start to do some of these things. I'm trying to kind of mix things up a little bit, spending that time, a bit of time in the office with the trainings that I'll need to continue to focus in on. But the rest of my time really just getting myself out there and just letting folks know that, hey, we care, you need to know this information, and we want to help you so that when the time comes and you are facing a challenge with a family member who's suffering from Alzheimer's or dementia, we're there to support and guide you through.
Wonderful. So what are some of the most fulfilling things about your position? You just talked about some of the, mundane things you got to go through, such as training, getting up to date with the systems, things of that nature. But what is the most fulfilling thing or things about the position?
Oh man, I mean, it's just I see it as a great mission. It's an opportunity for me to really give back to our community. That's very fulfilling, and just letting people know that, hey, you genuinely care about them and you care about their loved ones, who are having these struggles, and being able to just kind of share some words of comfort with them. So I see this as an additional arm of ministry, if you would. So it's just exciting to be able to just extend myself to the greater Rochester community in so many ways. And it's just something I love. I love people, and anything that I can do to just kind of continue to be a bright spot for them and serve as a trusted resource, then that makes life worth living.
That's wonderful, Leslie. Before I get to the last question, I just wanted to take a step back a little bit. You were talking about how important your faith is to you, and you mentioned briefly our African American Health Symposium. I think it would be worthwhile to tell our audience about your church and the relationship that it is now building with the Alzheimer's Association. Do you mind doing that?
Not at all. Not at all. I'm a member and officer of the Aenon Missionary Baptist Church, and we're located at 175 Genesee Street, right in the heart of the city. And we are the largest African American church in the city of Rochester. We have a little bit over 1,200 members, and we do some wonderful things in the community. And one of the things that we often talk about as a church is that I don't think we do enough to toot our horn. If there's something that's going on in the community that we can lend our support to, by all means, we're going to do it. And we're going to do those things because we just feel that it's the right thing to do. It's something that, we feel that God would have us to do. And we're not going to always call the news media or anything like that. We're just going to do it. And that's what we believe in, is just making things happen. If people are hurting, then we are that extended family. Then if they're hurting, we're hurting too. And anything that we can do to take some pressure off of them, by all means, we want to do it. And I'm certainly so very proud of the relationship that we have established with the Alzheimers Association, certainly through some of my efforts with just starting with the African American Symposium that we had. It was a great event. We had a wonderful attendance. It just couldn't have, gone any better. It was so exciting, certainly for me, and people from our church and people from the community came up to a lot of us afterwards and just talked about what a wonderful event it was, and the information that was shared. It's invaluable. So we just have to continue to do these types of things. And in the African American community, the church has been that central point to make those types of things happen. So we have a social responsibility to our community to continue to take some pressure off families that they're experiencing today.
Thank you so much, Leslie. And then the final question that we had for you is, what is the main message that you would like to get out to the African American community?
The most important thing, number one, is we want to make sure that as family members get older, that they're certainly, getting tested for possible Alzheimer's or dementia, just making sure that everything's okay, do what's necessary there. And the second part of that is making sure that or they know that their support, right? We have this wonderful organization here. We're nothing new to the Rochester community. And if you need some help and support to take care of your loved one, simply give us a call. Call our helpline, 1-800-272-3900, and we'll be glad to assist you. We have some wonderful folks within the organization that can provide services for you.
Well, Leslie, it has been a pleasure having you on the show today. Thank you so much for giving your input regarding what you're doing in the community as program director at the Alzheimer's Association, some of the methods that you'll be utilizing, and just your passion for getting the message out to the African American community. So we appreciate you, spending your afternoon with us to provide that information. And I hope to see you soon.
Yes, thank you guys. It's been a pleasure.
Thank you.